This slide that you're looking at is the ABCDs E's of melanoma. When we talk about asymmetry, we're looking at the mole or lesion as a whole. Is one half different than the other half? Are the borders irregular? That's the B. The color, are there uneven shades? Is one side light in color and the other side is dark? Or are there different shades of brown? Diameter is the D, and we're looking to see if a mole or lesion is greater than 6 millimeters in diameter. And E is for elevation. Is it raised versus being flat? So now we're going to talk about the physical assessment in regards to integumentary. So this starts on page 398 in your textbook, and as you can see, you are going to conduct this particular assessment by inspection and palpation. You're going to always look for color, presence of lesions. You're going to feel for temperature, texture, moisture, turgor, and edema, and we're going to go through each one of those for the most part. So when we talk about the skin assessment, we're going to inspect. Is there any colors? Do we note any odors? Remember we talked about those different terminologies for color. Are they pallor? Do you see cyanosis around the lips? Do you see cyanosis or really pallor fingertips? Is there any lesions or alterations that you notice? So when you're looking at your textbook and you're going through page 398 and you're looking at the techniques and normal findings, I also want you to pay attention to all of these chapters when we're talking about assessment, the abnormal findings, because you're going to be responsible for knowing what's normal, and then if something is not normal, what is the possibility that it could be. So you're going to also palpate. You're going to want to know skin temperature. Skin should be warm, not cold and not clammy. So you want to know the texture. Is the skin smooth? You also want to know moisture. Is it dry? Is it excessively dry? Or are they moist? Then we also want to know skin turgor. On the next slide, you're going to see a picture of assessing of skin turgor. What you are essentially doing is you're taking the back of the patient's hand. You can also do it on the chest. If you have little frail patients and they've been pretty beat up and lots of bruising on their hands from prednisone, you don't necessarily want to try skin turgor there, so you can try it on the chest. You essentially pull up the skin. If the skin stays tinted or up, that means the patient is more than likely dehydrated. They do not have great skin turgor. So you're actually looking for it to retract back down quickly. So this is the picture from your textbook in regards to assessing skin turgor. And what you're actually seeing is tinting. So what you would see is right here they are pulling up the skin. If she let go of the skin and this little part stays up, that's what they call tinting. The next picture you see, which I can't seem to move over for you all, is a picture of pitting edema. So when we talk about edema, edema is recorded as a +1, +2, +3, +4. This slide from your textbooks also gives you a measurement. So you can see that a +1 is 2 millimeters down into the skin. And then where you can see +4, it is 8 millimeters down into the skin. Plus it gives you a specific wording for each measurement. +1, it's lightly pitting. There's no obvious distortion. And then where you see +4, it has obvious distortion and it's pitted. So just keep in mind when you're assessing for pitting edema, we're not just doing that for the integumentary system. We're also going to talk about edema again when we get to the cardiac system, when we get to respiratory system. So it is an assessment tool that you are going to use very often. This is a picture from your textbook, and as you can see in the middle, this is a picture of pitting edema. This is a 4+ pitting edema. Alright, in this slide we're going to talk about hair assessment. You're going to inspect the hair. You want to look at the quality of the hair. Is it coarse? Is it fine? Is it brittle? Is there places of hair loss in the scalp or on the skin? There may be some alopecia, or they may have excessive skin. We talked about the hirsutism. The other thing is you're going to palpate, and that's where you're going to get that texture. You're also going to look for any kind of scalp lesions, and you'll also kind of make note. Is it red? Is there an excessive amount of dandruff? You're looking for any kind of changes or out of the norm range when you're talking about hair. The last part of the integumentary assessment is the nail assessment. You inspect the nails, you look at the nail curvature, surface, color, and thickness. As you can see on this slide, there is a picture at the very bottom of a normal nail, and there is a type of curve that we have, about a 160-degree angle in our nail. There's something called clubbing. There is also a picture in your textbook on page 399 which shows a good picture of nail clubbing. A lot of times you will see this in the respiratory patients or the patients with COPD. This is where the angle of the nail base is greater than 180 degrees. And what happens is the nail becomes really thick, hard, shiny, and then it curves at the end. So that is assessment things that you need to be looking at. Not only that, you're going to just look at the color of the hands and the feet. Are they pale? Do they have a cyanosis tint to them? We're talking about assessing hands and feet. When we get to cardiac, we're going to think perfusion, circulation. So this concludes chapter 15. So go through your chapter in your textbook. The other thing that I do not have on your PowerPoint, but we are going to do it in lab, so you do need to review it, is on page 400. You have primary skin lesions, and you have on page 401 secondary skin lesions, and then on the page 402 you have vascular skin lesions. You guys need to review those because you will need to know them for your test. And this way, if you review them ahead of time, it will help you out a lot better in lab activity that we will be doing in regards to them. So I will see you next week.